Hello and welcome. Today, we're diving into congenital rubella syndrome, a serious condition that can profoundly impact a child's life, particularly their vision and hearing. This video will explore the causes, effects, and ways to manage this challenging syndrome. We'll specifically focus on its effects on the eyes and inner ear. Congenital rubella syndrome, or CRS, is caused by a rubella virus infection during pregnancy. Rubella, also known as German measles, is typically a mild illness in children and adults. However, when a pregnant woman contracts the virus, especially during the first trimester, it can cross the placenta and severely damage the developing fetus. The earlier in the pregnancy the infection occurs, the greater the risk of severe birth defects. Once the rubella virus crosses the placenta, it can wreak havoc on the developing fetus. The virus directly infects fetal cells, disrupting normal cell growth and differentiation. This disruption can lead to a variety of birth defects, affecting multiple organ systems. In the eyes, the virus can interfere with the development of the lens, retina, and other critical structures. In the inner ear, the virus can damage the delicate sensory cells responsible for hearing, leading to hearing loss. The virus can persist in the affected infants for many months after birth, causing ongoing inflammation and cellular damage. The incidence of congenital rubella syndrome has drastically decreased since the introduction of the MMR vaccine, which protects against measles, mumps, and rubella. However, CRS still occurs in areas with low vaccination rates or where access to prenatal care is limited. Understanding the epidemiology or distribution and patterns of CRS helps public health officials target vaccination efforts and prenatal screening programs to reduce its occurrence. The signs and symptoms of congenital rubella syndrome are varied and can be quite severe. Ocular manifestations are common and include cataracts, which cloud the lens of the eye, glaucoma, which causes increased pressure inside the eye, microphthalmia, where the eyes are abnormally small, and pigmentary retinopathy, which affects the retina's ability to function properly. Regarding the inner ear, sensorineural hearing loss is a frequent and devastating consequence. Other common symptoms include heart defects, developmental delays, intellectual disabilities, and low birth weight. Infants with CRS can also exhibit a characteristic blueberry muffin rash. Diagnosing congenital rubella syndrome typically involves a combination of clinical evaluation and laboratory testing. If CRS is suspected based on the infant's symptoms and the mother's history, blood tests can be performed to detect the presence of rubella-specific antibodies in the infant's blood. These antibodies indicate an active or recent rubella infection. Polymerase chain reaction, or PCR, tests can also be used to detect the rubella virus in samples from the infant, such as blood or urine. An ophthalmological examination is critical to assess the extent of any eye damage. An audiological evaluation, including newborn hearing screening, is also essential to identify any hearing loss. While there isn't a singular classification system, CRS effects are often categorized by the specific systems affected. You might hear terms like ocular CRS, referring to cases with significant eye involvement, or auditory CRS when hearing loss is the primary concern, or the term is used when the hearing loss is particularly severe. These are not formal types, but ways to describe the dominant features of the syndrome in a particular child. Treatment for congenital rubella syndrome is primarily supportive and aims to manage the individual symptoms and improve the child's quality of life. Cataract surgery may be necessary to remove cloudy lenses and improve vision. Glaucoma management may involve medications or surgery to reduce eye pressure. Hearing aids or cochlear implants can help improve hearing in children with sensorineural hearing loss. Early intervention programs, including physical therapy, occupational therapy, and speech therapy, are crucial to address developmental delays and maximize the child's potential. Ongoing medical care and monitoring are essential to manage any long-term health issues. Prevention is the most effective strategy against congenital rubella syndrome. The MR vaccine is highly effective in preventing rubella infection. Vaccination of all children and women of childbearing age is crucial to achieve herd immunity and protect pregnant women and their unborn children. Prenatal screening for rubella immunity is also essential. If a pregnant woman is not immune, she should be vaccinated after delivery. Good hygiene practices, such as frequent hand washing, can also help prevent the spread of rubella virus. The prognosis for children with congenital rubella syndrome varies depending on the severity of the birth defects. Some children may have mild symptoms and lead relatively normal lives with appropriate support. Others may experience significant disabilities and require lifelong care. Recent research focuses on developing more effective antiviral therapies to treat rubella infection during pregnancy and prevent congenital rubella syndrome. Gene therapy and stem cell therapy are also being explored as potential treatments for some of the birth defects associated with CRS. While these are still in early stages, they offer hope for improved outcomes in the future.